you to Library's YouTube channel for the Another Life session. Today's session is brought to you as a patient awareness initiative in collaboration with Philips India. In this session, we have the privilege to host retired Brigadier Dr. Ashok K. Rajput, the Chief Consultant and Head of the Department of Pulmonology in Artemis Hospital in Gurgaon. With all of his experience and expertise, he's going to explain the most common issue, restless sleep and excessive daytime sleepiness, among all of us with the associated pros and cons. Welcome, doctor, and thank you for taking out the time.
Thank you.
So, to our viewers, as we all know, good sleep plays an important role in the overall health of each and every individual. Sleep is involved in many biological processes within the body, and its deficiency is linked to the root of many diseases and disorders. As the world is going through an anxious time of the pandemic, many of us are not getting good sleep due to one or the other reasons, but we are unaware of those clinical implications which may lead to. Due to the more time now spending at home and no little movement or very little movement usually causes the restless sleep at night and excessive daytime sleepiness. Thus, to combat this issue, we need knowledge from medical experts like Dr. Rajput, who have come forward to help us with his expert advice. So, during the next few minutes, Dr. Rajput will be talking about the excessive daytime sleepiness and restless sleep, and also the various unknown facts that were not put under the light, and we all are unaware of those facts. In this session, he will be explaining the basic informations related to the sleeping pattern, describing restless sleep and excessive daytime sleepiness with all the other related clinical details on the same. He will also put the light on the causes and the other reasonable links between the two and other clinical illness which may cause more implications. My request to you all who have tuned in, please feel free to ask your questions in the comment section and we will take them later. Over to you, doctor.
Thank you. So, today's topic is restless sleep and excessive daytime sleepiness. You see, sleep is very essential component of our life. 1/3 of our life we sleep, that is 8 hours out of 24 hours. In this 8 hours, all body's repair and regeneration takes place. And just like computer goes into sleep mode and fragments and does something in the background, arranges things, similarly, all ideas and future plans and everything keeps going into our mind when we are sleeping, and we get new ideas when we sleep. There are dreams and there are other things. Now, yet there are few people who are unable to sleep, or they get sleep with lot of difficulty, and their sleep is fragmented. And on the contrary, in the daytime, they feel sleepy, tired, fatigued, lethargic, unable to concentrate, and they are irritable in the daytime. So who are these people? These are the people who have not slept well in the night. Why do people do not sleep well in the night is, commonest reason for which a person comes to sleep clinic or to the doctor is unable to sleep. They do not know what are the reasons, and it is for the medical profession for us to analyze why he or she is unable to sleep and why he or she feels sleepy in the daytime. So the commonest reason, more than 80%, is obstructive sleep apnea. That is, you classically see patients who are obese, who are overweight, and they snore a lot in the night so that their partner or the spouse sleeps in another room, and they get frequent arousals in the night. Means they get up choking, gasping. Sometimes they get frequent urges to pass urine, and they visit the washroom repeatedly. And when they get up in the morning, they are not fresh, they are not alert, they are not active. they feel like sleeping more, and they stretch their sleep for more number of hours in the daytime. Yet when they go to work, they fall sleepy at their workplace. Sometimes even children find themselves sleepy in the classroom. So the commonest reason for these is obstructive sleep apnea. Means these are the people who are overweight. Their upper airway passage is narrowed because of the thick neck, a lot of fat deposited over there, and sometimes they have a structural abnormalities in the upper airway in the form of, in children, tonsils and adenoids, which the occupy a part of the passage of the upper airway. The upper airway becomes narrowed, and when they fall asleep, especially when they lie on their back, because of the gravity, the upper airway collapses, the tone of the muscle goes down. As it collapses, the passage narrows to such an extent that the flow of air, starts producing noise. That what we call as snoring. And after snoring for a few minutes, the snoring disappears. The passage gets occluded or choked, and the airflow stops, and their oxygen level drops. Here is the time when the brain gets aroused, and it sends a signal to these muscles to activate them, and they suddenly snort, and the passage opens. So again they fall asleep. So repeatedly this is happening in the night. The result is sleep becomes fragmented and unrefreshing. And many of these patients, especially in adults, it leads to oxidative stress. When I say oxidative stress, I mean one third of our lifetime when we are sleeping, our oxygen level is less than normal, and all our vital organs get less oxygen. This causes endothelial dysfunction. Endothelium is the inner lining of blood vessels. Its dysfunction leads to blood have a tendency to clot, and they are prone for high blood pressure, diabetes, impaired glucose tolerance, and other cardiovascular events in the form of heart attack and stroke. So it has a direct link with so many cardiovascular morbidities and mortality, and it's the commonest cause of death, especially in obese people. So this is the commonest reason. There are other reasons also. All of you must have experienced when you go to Europe or USA, you have a jet lag. You sleep in the daytime there, and you remain awake in the nighttime. That is called circadian rhythm disorder. So there are many people, by virtue of their occupation, they remain awake in the night, and they sleep in the daytime. So their rhythm is disturbed, especially those who are working, even in medical profession, working in ICU, they have rhythm disorders. And sometimes certain diseases, chronic kidney disease, liver disease, or malignancy with a lot of pain. Because of the pain, the patients are not able to sleep. So they have a secondary cause. There is some other disease, they are not able to sleep. And sometimes psychiatric disorders like depression and other thing, and they do not get sleep in the night. And sometimes people use drugs like alcohol, caffeine, or certain other smokers, and these drugs, and they cause, they activate the brain and stimulate the brain. They disturb, fragment the sleep, and they do not get a REM sleep or a deep sleep, which is the essential part for the night. And these patients also have sleep problem. So there are many reasons for which a person does not get a good restful sleep, and he or she feels sleepy in the daytime. And of course, there are certain neurological conditions like narcolepsy, when they feel suddenly sleepy in the daytime. At any time, these people tend to fall asleep. So these are the common things by virtue of which the patient feels sleepy in the daytime, and his or her sleep is fragmented or unrefreshing in the night time. Yeah.
Thank you for providing us with such an insights, doctor, over this particular problem. So now I will take some questions from our viewers. So, just like we are having this topic now, so what are the actual causes of restless sleep and the excessive daytime sleepiness?
As I told you, the causes are insomnia, like psychiatric disorders. Certain people, they do not get sleep in the night. Obstructive sleep apnea. I gave you little details about it. And then there is restless leg syndrome, especially patient in ladies, anemic, pregnant ladies. They keep moving their legs in the night. They have a electric sensation, or warm-like feeling in the legs, and the circadian rhythm disorder means the work culture is changed. Sometimes people work late in the night till 2 o'clock, 3 o'clock, and once they fall asleep at 3 o'clock, they cannot get up till 11 or 12 in the daytime. So that disturbs their sleep. And certain drugs, like people addicted to alcohol, smoking, marijuana, that disturbs their sleep. People suffering from some painful disorders, like the malignancy, or chronic kidney disease, liver disease, where their sleep is disturbed because of the pain, and certain condition in which the patient has to get up frequently in the night to pass urine. Even enlargement of the prostate causes nocturia. Frequent urge to pass urine will disturb the sleep. And in any case, whatever reasons I told you, the wherever the sleep quality is poor, these patients, they have restless sleep. And once the sleep in the night is restless and poor quality, naturally body will try to compensate in the daytime, and they will feel excessively sleepy in the daytime. So that is how the body tries to compensate. So once you feel sleepy in the daytime, you remain irritable, your concentration in work is not there, and you are agitated, and you get anger very easily, and your performance level goes down in the daytime. So these are the people who get a changed personality, because just because their sleep quality is poor. And basically these are the people which much of the things we can avoid by virtue of sleep hygiene. When I say sleep hygiene, like we, in the morning when we clean our teeth, we brush, we use toothpaste, we take a bath, we use soap. Similarly for the sleep, you have to observe sleep hygiene. When I say sleep hygiene, you mean to say you should go to your bedroom only when you feel sleepy. Your bedroom should not be a place where you are watching the TV also, reading the book, and your mobile, your iPad, or your laptop is also there in the bed, and it is not well made bed. And there are a lot of sounds, there is a lot of light, maybe of the lights of the voltage stabilizer, or sound of a fan which is revolving, and which is disturbing your sleep. And there could be any constant source of irritation in the night, because when you are sleeping, it should be soundless room, lightless, totally dark, non-noisy room, and bed should be well made, and you should not be consuming any alcohol or smoking or any nicotine or caffeine product in last 5 to 6 hours before going to sleep. And you should not be having a very heavy meal. A heavy meal will cause a lot of reflux, and it will disturb your sleep. Yeah. So there are many factors you have to consider for a good sleep in these patients. If you avoid these, then definitely if your night sleep is disturbed, so you will feel awful in the daytime. So these are many reasons when people do not get a good restful sleep, and they feel sleepy in the daytime. Yes.
So it's like, why do they feel all time sleepy, and what should they do to overcome these things?
They feel sleepy because their body is not rested in the night. Our body gets repair and regeneration in the night when we sleep. If you do not sleep, if you don't have a good quality of sleep in the night, if it is fragmented, disturbed, then you will feel sleepy in the daytime, because the body will try to take adequate rest in the daytime. So they feel sleepy in the daytime because night quality of sleep is very bad. So that is why they feel sleepy in the daytime.
And what are the risk factors which can worsen these conditions?
See, the risk factor which can worsen the sleep condition is one I told you is the weight. These days you find a lot of people, who are more than 100 kgs, they do not exercise, and many of them, they take alcohol, they smoke, they try to take a lot of tea or caffeine, and sometimes even drugs like marijuana, and these all they disturb their sleep in the night. So, and they don't follow the sleep hygiene, what I told you, is very essential. The room should be dark, be soundproof, and the ambience temperature should be very, soothing and cool. Bed should be well made, and not a heavy meal in the night. See, in fact, we say the breakfast and lunch should be heavy. The night meal should be very light, so that you sleep well in the night. And sometimes, certain diseases like hypothyroidism, which also affects, the soft tissues in the neck, causes more snoring and tiredness and fatigue and poor quality of sleep in these patients. So we have to watch these patients. And of course, poor sleep will lead to hypertension, diabetes, the other cardiovascular events indirectly to these patients because of the oxidative stress. So it is two-way. There are conditions which lead to poor sleep, and the poor sleep will lead to dangerous conditions like cardiovascular events.
And it's very nice thing that. And also, what are the clinical implications which all are associated with restless sleep and excessive daytime sleepiness?
I enumerated you all the clinical conditions like sleep apnea, restless leg syndrome, circadian rhythm disorders, certain drugs, the painful diseases where you have a lot of pain, nocturia, frequent urge to pass urine in the night, and these are the conditions. And even narcolepsy, which is a neurological disorder, when a person feels very sleepy in the daytime, he can sleep off anytime, anywhere, and just drops even while talking or listening to some something, and sometimes they fall off, feeling sleepy. So sudden loss of muscle tone or sleep paralysis, and sometimes they get hallucinations also that somebody is there in the room, and in fact there's nobody. So these are neurological condition also which lead to this condition. These are the few conditions, and which lead to sleepiness in the daytime.
So, how we can prevent these conditions?
Few of the conditions are preventable, few are not. You see, if you have narcolepsy, actually we don't know the exact cause, but there is, problem in certain neurons in the brain, and the secretion of hypocretin or orexin, which is a chemical in the brain which regulates the sleep and wakefulness, is less in these patients, and it may run in families, and they feel loss of muscle tone, sleep paralysis, hallucination, and excessive daytime sleepiness. So 1 in 2,000, 3,000 patients, and it remains undiagnosed for a long time. And because the symptoms are very subtle, they just feel sleepy. That's all. And this is one, and all those. I enumerated, weight. Weight is the most important thing in the 21st century, because the habit of exercising, walking has gone down in our patients. We, just sit in the car from the door and goes to the XYZ place and come back in the car. And we eat fast foods and a lot of sweets and this thing, which lead to, weight gain. And India, is the capital of the diabetes because of the overeating and no energy expenditure. Say, incidence of diabetes is very high in our country. So is the overweight. No longer, India is a poor country. Earlier, there was dearth of food in this country, but now we have surplus food in this country, and the affluence has also increased. People eat a lot, don't exercise, they gain weight, and this leads to obstructive sleep apnea. And then, of course, the work culture has changed in many of us. Like, we remain awake in the night. They're no longer, in our childhood days, we used to sleep at 9 or 10 o'clock in the night. But now I find, children remaining awake till 2 o'clock, 3 o'clock, and late night parties. And sometimes, by virtue of their work culture, so they work late in the night, and that is at the cost of the day. So our performance is usually best in the daytime. If you sleep adequately, rest adequately, your output, your performance will be much better in the daytime. But if you damage your sleeping habit and the culture, and do not maintain the sleep hygiene, and then you spoil your health as well as the sleep. So these are the reasons, few reasons I enumerated.
So, doctor, is it also there कि if I'm suffering from these two diseases, the restless sleep and excessive daytime sleepiness, so it also means that I'm suffering from obstructive sleep apnea?
No, obstructive sleep apnea is very easily diagnosed. It's very easily diagnosed. If you are overweight, means your BMI is say 30 or more. If you have a thick neck, and if you are snoring in the night aloud, means whosoever has ever watched you sleeping, he or she complains a loud snoring, and which is fragmented. There are episodes of snoring which stop in between, means there is apnea. And when you get up in the morning, you're not fresh, you're not active, you're not alert, you feel like sleeping more. And in the daytime, you are sleeping and tired. And if you are driving a car, you feel sleepy. In the red light, uh, when the red light traffic, people just sleep on their seat when they are driving. And it's the commonest cause of roadside accident, because they feel sleepy when they are driving. So these are the patient, and if they have developed diabetes, they have developed impaired glucose tolerance, they are obese, with thick neck, and snoring. So it's a clinical diagnosis. Only thing is, you need to confirm in the lab by doing polysomnography. When I say polysomnography, it's a test done during sleep. Poly means multiple, somno means sleep, graphy means recording. So there is a multiple channel of recording during sleep, where we record the brain activity, the muscle activity, the eye movements, the airflow, the snoring component, and the oxygen saturation, the thoracic movement, abdominal movement, leg movement. So few channels are applied in the body, and overnight recording is done. We come to know of important index, that is AHI, apnea hypopnea index. If the index is more than 5, then you have clinched a diagnosis. If there is desaturation, means your oxygen level is going down when you are sleeping, you clinch a diagnosis of obstructive sleep apnea. So it's the most easily diagnosed condition.
And just like I said, obstructive is sleep apnea. So I just want to know what actually the sleep apnea, what are its symptoms?
What I enumerated, these are the symptoms. Means your sleep in the night is unrefreshing, with frequent arousals. You gasp and choke in the middle of the night. You go to washroom to pass urine again and again. And when you get up in the morning, you don't find yourself fresh. You feel like sleeping more. And in the daytime, you are tired, you are fatigued, you are lethargic, you are unable to concentrate at work, and some of them, they feel impotency, and they feel sleepy in the daytime. As the day progresses, they feel tired and sleepy. So these are the symptoms. And of course, some of them, they have morning headache because of the retained carbon dioxide or development of high blood pressure. Many of them, they have impaired glucose tolerance or the diabetes development. So these are the symptoms the person with obstructive sleep apnea has.
So, doctor, if I'm suffering from restless sleep or excessive daytime sleepiness, So should I go to doctor? And if I'll go, so what are these conditions which they can easily be diagnosed?
Yeah, you see, there is a important Epworth sleepiness score. There are 8 questions. You get it on the internet also in any doctor's clinic. We ask 8 simple questions, and the patient answers himself by giving marks. 0 marks means it is not there. 1 means mild chance of there. 2 means moderate chance, and 3 means severe chance. The questions are: if you are sitting and working, do you feel sleepy? Is there mild chance, moderate, or severe chance? When you are driving, do you feel sleepy? If you eat a good, sumptuous meal in the lunch and you are seated in the chair, will you feel sleepy? So similarly, there are 8 questions. Out of 8, the maximum score is 24. 3 marks in each, 24. If your score is more than 10, you are most likely suffering from sleep apnea. Similarly, if your collar size is more than 42 or 43, means a thick neck, your chances of sleep apnea is there. If somebody in the family, your spouse, has seen you snoring, heard you snoring, which is fragmented, and then you should see the doctor. Means snoring, overweight, thick neck, and fresh development of high blood pressure or diabetes, and Epworth sleepiness score of more than 8 means you're driving, you had an accident, you don't know the cause, you just banged into the side of the road in a tree, means you felt sleepy, and you may be suffering from sleep apnea. So these are the patients who, if you fall in any of those categories, they should see a doctor.
Doctor, just like yoga, pranayama are helping nowadays in so many things. So does they also help in self-managing the sleep apnea?
Yes, yoga and pranayama will help you in, you know, do not gain weight. If you improve your weight management, especially the abdominal exercises and the neck exercises, what we call as myofunctional therapy, means you stretch and exercise your neck muscles. Don't let it gain weight by doing yoga. You can avoid, because this is a lifestyle disease which occurs only in people who do not exercise, who gain weight, their eating habits are not good, they are addicted to alcohol, smoking, and other addictive things, and you can avoid definitely.
And also, what are the right therapies we can take to avoid this sleep apnea, and how it can also help a person to feel better?
So first and foremost is, I told you, is the prevention. This is a disease which can be prevented if you don't let your body weight to uh, go in the BMI more than 26. The chances of your developing sleep apnea is much less, especially if you don't have facial congenital facial anomaly in the form of micrognathia or retrognathia. So if you have a lot of nasal obstruction during sleep, some patients have allergic rhinitis, so they should avoid allergens, and they should use anti-allergen nasal spray when they sleep. This will help, and this will help in sinus inflammation and treatment of allergies, and certain the nasal breathing training, or jal niti or other wash type of thing, which clears the passage in yoga, helps these patients. And in children, especially if the tonsils and adenoids are very big, removal of those tonsils and adenoid will just cure their problem. And the myofunctional therapy means the exercise of the neck muscle, I have told you, and Otherwise, if you are not able to do all these things, still you suffer from disease, then we have very good therapy in the form of CPAP, the continuous positive airway pressure, in which we give a small mask over the nose, which is connected to a machine, which gives pressure and which keeps the airway patent and open. So snoring disappears, the oxygenation is optimum, and you find yourself fresh, alert, and active in the daytime. You are no longer sleepy in the daytime. And of course, weight loss and positional therapy. Many of these patients, we tell them to sleep on the side. It is difficult, but the sleep apnea is more when they sleep supine or in the back. So positional therapy, these are the common things we do to these patients so that they can sleep better. And of course, follow the sleep hygiene steps, which I told you means they should go to the bedroom only when they feel sleepy, and they should not indulge in all those activities of watching TV, reading books, and playing on mobile or iPad or laptop, before sleep. And at least they should give all these things 1 hour before sleeping, and the room should be without any disturbing light and soundproof, and follow all the steps. Avoid alcohol, avoid smoking, avoid tea in the for last 4 to 5 hours before sleep. Do not do exercise in the evening. Some people have a habit of doing exercise or playing at 8 o'clock in the night, and they think they will sleep well at 10 o'clock. They cannot, because exercises increases the adrenaline and dopamine in the body, which makes you more alert and active, and does not help in sleep. So if you have to do exercise, it should be done early in the morning. So that exercise is also essential, by which you feel tired and fatigued and your sleep quality is good. So, but it should not be done in the later part of the day, just before sleep. So if you follow those sleep hygiene steps, it helps a lot in these patients.
Thank you so much for taking the time to address these questions, doctor. It was a very enlightening session, to say the least. To our viewers, we hope that we could cover all your concern around the issue of restless sleep and excessive daytime sleepiness. For any health related queries, please do reach out to a specialist doctor near you. Library provides you all the true and authentic information about any health concern. Also regarding the sleep disorders, you can visit our website for the details. For further updates, stay connected with Library and Good MD. Thank you.
Thank you.